Hello and welcome to the Therapy Corner. On the Therapy Corner, what we try to do is help you to understand psychology, psychotherapy, counseling, try to dispel some myths and encourage you to undertake maybe therapy for yourself or encourage it for others. Today, we're very lucky to have on board Julian Varela. Now, Julian actually at one point in our mutual careers was one of my interns, so I'm very gratified to have him here. He's done great work and gone forward. He's been a licensed therapist for some time now, and he also is a health and wellness expert, which is the reason I asked him on the show, because he does things just a little different. Hello, Julian.
Hello, Uli.
Good to see you again.
Thanks for having me on.
Okay, so as I said, you're a health and wellness expert and you do things a little differently. I'm not saying that you do something odd in your therapy, but what do you do that's different?
So I actually began my career in the health and fitness world. As a matter of fact, I worked as a personal trainer during my entire undergraduate and most of my graduate academic career. And so with that said, I actually was the therapist per se, personal training therapist, that is, right? Every client that I worked with over the years in that type of a realm, I met with twice a week, 3 times a week, once a week.
Sort of a fitness coach kind of thing?
A personal trainer, right.
Ah, okay.
And so that's actually how I ended up moving into the health and wellness world while going through the graduate program at Cal Poly. So I actually got my master's in exercise science and health promotion.
Okay.
And so with that said, the consistency that I've seen, or that I saw, I should say, with the past clients that I've worked with in the health and wellness world, it did them a lot of good. They started to show up right on time, Monday, Wednesday, Friday, and they had to build their entire day around that particular workout, self-care. And so what I found was not only, of course, there are a number of benefits which we could talk about in terms of benefits to the brain when we exercise. More than anything, it was the structure and consistency and time management that really helped the clients to adhere to a self-care program, if you will, while at the same time increasing their confidence and achieving some goals and objectives, which help them to become more motivated.
So what I'm hearing is that you sort of incorporated into your therapy, your counseling, your therapy, whatever you want to call it, you incorporated into that some of the principles you had picked up in coaching and incorporated those so that it provided, as you say, a better structure for them that they could adhere to.
Absolutely.
Okay.
It's the time management. I think that gets away from a lot of us. And also, when you think about it, it's the structure that also for a lot of people, and for children too, is what keeps them feeling safe, right, and secure. They know it's coming. And so when we do a better job organizing our day and really prioritizing our time, we're certain to take care of ourselves, which a lot of our clients, as you know, do not do. So I think it's a great foundation in terms of the early stages of when I'm working with a client. Is I really want to see them start to create more structure in their life, self-care, prioritize themselves. That way we can start really focusing on some of the other areas of therapy.
Okay, so I could see, sorry, I don't mean to minimize what I'm hearing because I'm sure you do some incredible work, but you know, it's sort of like I say, well, if somebody has an adjustment reaction to life, you know, probably a coach would be just as good as a therapist. But if somebody who's coming in with, say, general anxiety disorder or major depressive disorder, how do you use the wellness and fitness to work that into a better therapeutic process?
Sure, okay. So I think I can also add an additional layer in terms of some of the other colleagues that I work with. So I have actually in my practice a few others. I have one registered dietitian named Lisa Dawes, and then also medical doctor, Dr. Lapidus. And I'm lucky enough to work in close proximity, i.e. right across the sidewalk or an office away. And so when I have a client that comes in, if they are dealing with generalized anxiety disorder or major depression, I like to also ask, when was the last time that they've seen their doctor? When was the last time that they had a full blood panel, hormone panel? How are their blood sugars? So understanding some of those I guess, biometrics, biomarkers
Okay.
can really help us to see if there are any underlying conditions, medical or health underlying conditions that can lead to depression or anxiety.
Yeah, so you
part of it.
actually go deeper than the average therapist or counselor in the sense that you well, nowadays they call it integrative or integrative medicine or therapy. In the old days, we used to just call it holistic medicine,
Right.
where you stop looking at the person as just, oh, you've got some mental disorder, or you stop looking at the person as, oh, you just have a physical disorder. We take the whole being into account. So it sounds like that's what you're doing. You're not just, get somebody in there with major depressive and say, okay, I'm going to do therapy with you. No, you say, okay, like you use the term biomarkers. We're going to get you set up with a doctor, see what's going on with you physically. Maybe set you up with a nutritionist. You take it a step further, though, don't you? Recommend exercise and stuff?
Absolutely. So again, in the past, I also worked as a strength and conditioning coach for a university. So I had the opportunity to train people a lot taller than me, basketball players, and bigger,
People you got to look up to.
Exactly. And so I have a lot of experience in designing programs that are appropriate for the beginner, expert, you name it. And so we'll go through that and design something that will really fit into their overall lifestyle, and then show them how to do it. So give them some instruction on how to go about the routine and how to then see how we can integrate their family into the process as well.
Oh, so you bring in the family. You don't just look at the individual. You look at the family structure and the dynamics there.
Absolutely.
Oh.
I guess this goes back to my early work in the wellness world and my thesis in grad school, number one, which was on childhood obesity intervention and treatment and integrated community programs. And that really was the catalyst that shifted my desire to really understand health behavior and behavior change. Because when you think about childhood obesity, for example, we could send them out to exercise or ride their bike or participate in some type of a sport. However, it's when they come home in the food choices and how active they are, or if they play video games all day, really there's not much we can do until we can reach the parents.
Well, that makes perfect sense. So you would not only set up like a nutrition plan, exercise plan, but you'd also look at the family dynamics and structure and look at it in terms of what's going on there that might be promoting obesity, right?
I guess you can think of it as co-parenting.
Okay.
Right? When we co-parent, we're on the same page. We're taking time to discuss challenges, solutions to what's happening with our children, and if we're not supporting each other in that way, and one parents differently than the other, it can get a little messy, and that is also something that affects our health.
Okay. In those situations, I'm curious, how's the buy-in with the parents? For instance, with some kid with childhood obesity, do you get them to go along with it? Are they really invested in and concerned enough to do what you're suggesting?
Yes.
Okay.
In some regard, not always. When I say not always, I like to take little steps, tiny steps. And some of these steps, for example, are simply reorganizing the structure of their home to help encourage healthier food choices and minimize the unhealthier options. For example, if you put food in a opaque container, for example, you can't see through it. You can have some of your favorite snacks and crackers or whatnot, but put them in a container that you really can't see through, and then take your fruits and your vegetables and put them in glass containers at eye level, right? So how all the marketing companies work, right?
Of course.
So yeah, that's the goal, is to really try and begin with some very easy behavior change, which is again the structure of the home, the environment. And when we can get one little thing moving in the right direction, then we can start focusing on adding the extra layers, bringing the family in.
Okay.
Yeah.
All right. Well, I'm going to backtrack a little and go back to, major depressive disorder.
So depressing.
Yeah, I know, isn't it? When you get somebody in who wants to see you for therapy, counseling, for their depression, do you always work in the health and wellness thing, or do you sort of evaluate whether this person's going to be open to that? I'm just kind of curious. If I came into you and said, okay, I've got major depressive disorder and I just don't know what to do. I feel like killing myself most of the time and I can't sleep at all and I'm eating everything in the refrigerator and, nothing's worse, all the classic symptoms of depression. What are you going to do?
Refer them to you.
Gee, thanks.
One of the things that is very helpful is expanding the intake. Paperwork. So within my intake, you'll also see, are you currently exercising? Are you currently physical activity, involved in physical activity? If not, how interested are you? Somewhat, a little bit, not at all. So we're incorporating stages of change questions within the intake as well. So before the client even comes in, I can take a look and see what I can grade their lifestyle per se.
Gotcha.
And so based upon where they are, of course, that's where we would meet them. And as far as integrating wellness into that first session, I would say most likely not. We first want to start creating some type of structure. And then also what I like to do occasionally is to take my clients on a walk.
Oh, how interesting.
So take them on a 20-minute walk one direction, 20 minutes in the other direction, process at the end in the office, and on their way.
Oh, how interesting. Huh, a walk.
Walk and talk.
Walk and talk. What do you get out of that?
First of all, I burn calories. So,
so it's good for you.
It's good, yeah. Well, when we're moving, we'll notice that our circulation increases, right? We may feel a little bit more focused. We may start to, just recognize or more clarity, I guess, is what I'm trying to say. More clarity. There's something to be said when the body is moving. It can help to shift the mind as well.
Right.
And then furthermore, just because some of the benefits of physical activity really affect the brain.
Yeah.
It can help with neurogenesis, new neurons,
Sure.
right? Learning, memory.
Yeah.
And so if we can sneak that in during a session, by the end of the session, not only will we have a good conversation, but we'll also have help them feel a little bit more confident, like they did at least one positive thing that day.
Yeah, well, being excuse the expression, an old fart, and I come into you and you say, well, let's take for a walk, and I'm going to look at you like, say what? Do you get much resistance for it, or?
I think that's just you.
Could well be.
I will begin pretty much every session explaining the background, my background, and what I have found to be helpful with other clients. And if they are interested in incorporating movement or walking for part of our session or every other week, then let me know. And they'll either say, oh yeah, I'll think about it, or sure, let's start doing that. So I would say it's about 50-50.
Yeah. Interesting, because one of the things that I enjoy is walking meditation, which is a little different. I mean, you're sort of tuned in on self and you're being one with the environment, so to speak. I hope I'm not stepping on any Zen Buddhist toes here, because I don't necessarily say that eloquently enough. But I do get a certain joy out of the peace and quiet of being with myself in the stillness of a walk. But you're going to be talking to those people. It's sort of interesting because we all know that one of the best things that you can do for depression or anxiety is exercise. Yeah, and so it's kind of an interesting way of getting them started on it. I may start doing that myself. I like the idea of going out and saying, let's take a walk and talk instead of just sitting in these chairs.
Right.
Let's get out of the office, get a little fresh air. We're not in LA, that's right. We can get fresh air. You can get a little fresh air and let's talk. And yeah, it might get them on the idea, because one of the biggest obstacles, as you well know, is with somebody with major depressive disorder, is getting them motivated.
Right.
That's always the obstacle. Well, yeah, I know exercise works, but I don't feel like it.
Right.
They don't. So, maybe taking them for a walk is a great way to get them started.
One of my old mentors in college, Dr. Bill Sands, actually, he was a United States department chair and also on the United States Olympic Committee as a coach and sports scientist. And one of the things sayings that he used to throw out was motivation is not a feeling, motivation is an action. And so when we put our bodies in action, it will stir up a positive emotion, which is the motivation. Meaning, we usually don't feel motivated until after we do it. Right? Until after we exercise, after we walk, where we feel more energy. We feel just a little bit more lively, and like I said, clear-headed.
Well, that makes sense. I mean, we can go all the way back to the first American psychologist, William James, who's, I always paraphrase him, this isn't an exact quote, but, we do not run because we're afraid. We're afraid because we run. And so basically your coach there is saying the same thing. Motivation is like, that's what's happening when you're actively doing, and then you just put that name to it. So, yeah, okay. But again, so getting them out and moving is a really good start to getting them into the idea of continuing an exercise program. Well, that makes perfect sense. Okay, so how do you fit nutrition into all this?
Well, I leave that to the experts. I do know some around sports nutrition and the basics. However, if that is an area that could need some attention and focus, then I like to refer that client to our in-house dietitian.
Okay, here again, how do you decide as a therapist that this person may benefit from a nutritional evaluation?
So again, a lot of that will go back to the intake. Same thing. How would you rate your current diet? Would you be interested in learning how to improve your diet? Yes, somewhat, not at all. So at least that can help us to start the conversation, right? I can actually refer to that question and ask them to tell me a little bit more about what their habits are. And then also provide some psychoeducation around nutrition and how it can help to support our mental health. And everything from just drinking water, for example, helps us to maintain a steady blood flow, right? Sure. And helps us when we're hydrated, our brain is functioning a lot better than when we're not. Our blood is less viscous when we are consuming our fish oils and omegas. That helps us support brain health as well. And now we know we're learning so much about gut health and microbiome as it pertains to serotonin and mental health and mood, that it definitely is something that we want to consider.
Yeah, it's sort of interesting you should mention that, because for those of you out in the audience who haven't heard about this, there is a lot of new research out there that seems to indicate that our gut has an incredible effect on our brain. I know when I'm teaching in my general psych class, one of the things we talk about is that the brain consumes 25% of all calories taken in. It doesn't say anything about the other nutrients, but it says 25% of all the calories. Well, stop and think about it. It's just not a giant leap of logic that if you've got 25% of your calories going to your brain, you got 25% of everything else going to your brain, at least, And so I just find it odd that you can't make a gut-brain connection. I'm surprised it's taken us this long to figure it out. So how do you incorporate that into your therapy?
In terms of nutrition and brain health?
Okay, well, yeah, because I mean, like I said, the research out now about the serotonin, as you mentioned, and the serotonin link with the brain. And again, for those of you out there who don't know, serotonin is what's usually responsible for the depression, okay? We have a hormone in our brain, or actually it's a neurotransmitter called serotonin, and most of your SSRIs, which are your antidepressants, they're called reuptake inhibitors. They keep the serotonin level in the brain going to keep you in a better mood, okay? So serotonin is very important for your mood, all right? So having it come from your gut, wow, that's huge.
And there's still a lot of research that needs to be done to better explain if the serotonin in our gut, how does it go through the blood-brain barrier, or does it support serotonin in some other area? So yes, providing psychoeducation around a lot of these discussion points, I think, is one of the best things that we can do, because it's really interesting. If you have an adult who is a working professional as well, educating them on the health and wellness component of a healthy lifestyle and as it pertains to mood, we can also discuss how it will impact their work, how they can become more focused, how they can perform better at the end of the day, how they can feel better about themselves when they do that. Sure. Going back to exercise too, one of the things that I don't know if a lot of people know, we have a gene responsible for creating a protein called brain-derived neurotropic factor, or BDNF. And essentially, well, there's a movie out there with Bradley Cooper called Limitless, and it was this pill that he would take, and everything would open up, and he felt so smart. But that doesn't work like that. However, what it does do is it does, as I think we mentioned earlier, it does support learning, and it supports memory. We're going to be sharper. It helps. So many other things. Again, neurogenesis, new neurons. It helps to support the health of our existing neurons. It gives them a longer shelf life, if you will, as well.
That's very cool. So this BDNF, right? Did I say it right?
Yeah.
Is that available over the counter or prescription, or
we make it through movement. What researchers have done is they've monitored what happens with the overall levels of BDNF pre and post exercise, and also over a period of time. One of the most recent studies that I reviewed, they had their participants exercise 3 times a week over a 4-month period, and during that period of time, all of their participants noticed a significant increase in BDNF after they exercised, at approximately anywhere between 20 minutes to 45 minutes of aerobic activity.
So, well, this is kind of cool, because now we have some, I'm going to say, scientific proof for the description of what happens when we exercise that helps us to relieve our depression and our anxiety.
Absolutely.
So we got BDNF, which we never had before. All we had was, exercise, the research shows that exercise does just the same job as your antidepressants do, unless you have severe depression. If you're mild to moderate, you're fine. You can exercise and get rid of your depression, but we didn't know about BDNF.
Well, now we know so much more that it's unfortunate that exercise and wellness has been marketed the way that it has over the years, in terms of it's all about your physique. It's about how you look. And of course, marketing companies have taken advantage of this as well.
Oh, sure.
It should have really been marketed as a mood enhancer, as a brain booster, as a way to prevent, and or support not getting like Alzheimer's and Parkinson's.
Right.
And BDNF is also responsible for treating Parkinson's as well. And we're taking a look at the impact that has on the overall disease. Another thing that I just read real quickly is
go ahead.
Pregnant mothers. There's research out that has shown that mothers that were physically active during pregnancy over years had children that were more intelligent, that scored higher on verbal language tests and also mathematics.
Wow, that's pretty impressive. Because I grew up in the generation that basically, you're pregnant, stay quiet, stay in bed, don't, And then, we got to a later generation where they said, no, whatever you were doing before, you keep doing, unless there's a problem, Now they're saying, gosh, be active because it's good for your kid.
And it changes our genes, literally changes our genes.
Wow, yeah. People don't understand that, by the way. You can change genes.
I changed these this morning.
I'm glad you did.
Sorry. The other type of genes, right?
Yeah.
Got it.
The little guys inside of.
Right.
Yeah, because I always talk about in my classes about having predisposition towards certain things. We're given some genes at birth, and we don't have any choice on that, but we can alter the genes.
Yeah, we can tweak them.
Yeah, and it doesn't have to be in some laboratory either. There are things we can do that can actually tweak genes, and I can see where your health and wellness ties right in with that, because you're trying to create a better, stronger mind-body connection, a healthier overall person.
I think we can do it a little bit more expeditiously if we are treating the whole person, get them to a point where they're going to feel better sooner.
Well, that makes good sense. Yeah, because trust me, I would love to get my patients who come in with depression and anxiety in on that damn treadmill, but it's like, it's like, it really works, and I'm glad to hear you're doing it. Are you doing anything else with integrative medicine? Are you well, it sounds like what you're doing is integrative medicine, but you're doing anything on a more, what do I want to say, concise, precise, business-like model, or is it just you farming out people to nutritionists and doctors.
In terms of and how I work with my
Yeah,
clients.
yeah.
Oh, I'm actually going through a training right now, about halfway through, and it's a neurotherapy training program, actually with Dr. Lapidus. And so what I'm learning is a lot more about the different brain frequencies and how we can alter brain frequencies by mapping the brain using something called QEEG and then biofeedback. We can actually see how the brain is firing, almost like your engine. If it needs a tune up, you can see that. You can see where that needs to be tuned up. So when we take a look at mapping the brain, we can literally see in real time how the brain is operating, which areas of the brain are operating at a normal frequency, and or areas of the brain that are inactive. And so in some of the research that we've reviewed, you can actually see in patients that are struggling with depression, you can see the area of the brain that is inactive and most likely responsible for that.
Wow.
And to have clients have the ability to see their own brain, it makes it more real, right? It makes it more real.
Wow.
So that's one area that I'm working on.
That's really impressive. Gosh, that sounds like most people could benefit from that.
Absolutely, absolutely.
You know, not just somebody who's depressed, but somebody who's going to use a term I hate, normal, could benefit from that in terms of how they could be better.
Absolutely. Actually, Dr. Lapidus is scanning each one of her patients to provide a baseline marker for memory on Alzheimer's.
Oh, interesting. Yeah, because there's a lot of new research I've seen coming out on Alzheimer's in particular, and there seems to be some hope there too. So, but it's not exactly in our field, it's more medicine.
Right.
Any last things you'd like to share with about yourself or your practice or what you do here in the last couple of minutes?
A health club environment, for example. I remember I became really inspired with some of my early clients because I would see a client that would come in and baggy sweats and a baggy shirt and poor posture. And after a period of time, we saw well-fitting pants, well-fitting clothes, posture improved, new haircut, you name it. That over a period of time, to be able to witness a client's increase in confidence and just to see how much better they feel about themselves is priceless.
No kidding.
And if we can integrate something like that in with what we're doing with therapy, when we're treating the client, at least encouraging them to do that, I think we'll see much more, a greater success in adding that confidence boost.
Excuse me. Okay. All right. Well, listen, Julian, I want to really thank you for coming in today and being on the show and helping to open up our minds to the idea that exercise, nutrition, well-being is not just for the gut and for the body, it's good for the mind as well.
Absolutely.
So, and, they can contact you and your phone number, it'll show on the screen.
Okay,
So
great.
Good luck and be healthy.
Thanks, Willie.
Appreciate you being here, Julian. It's good seeing you.
You too.
again. All right.
See you soon.
Okay, folks. Well, that wraps it up for this time around. Just want to say a big thank you to all of you again who have come to visit us. And we're going to continue in the same vein, showing different ideas and things. We hope to have some different modalities on here so that you can get insight into different approaches and ideas to help you live a healthier, both mentally and physically, healthier life. So thank you again for watching.